Hi, it's me again. Good day to everyone. Welcome back to Make Health Wealth Your Passion with Ricky. So today I'm going to talk about fistula. Yes, many people may not know what a fistula is, so I'll be explaining what a fistula is and how it's being formed. As some people may know, I've gotten a fistula, went for a day surgery, and now I'm recovering from the fistula surgery. So, so I will talk more about fistula today. I came across this website which is pretty good in explaining what a fistula is. Mine is an anal fistula, which is a tunnel that is linked from the anal canal, internal opening, to the skin of the anus, which is the external opening. So basically, what an anal fistula is a fistula is a tunnel or channel between an opening in the anal canal, which is the internal opening, and an opening at the level of the skin around the anus, which is the external opening. So it says here that the average age of people having fistula is 40 years old. And men are affected twice as often as women. They didn't explain why that is so. And the incidence of an anal fistula is 169 cases per 10,000 people, which is not very common. So that's why not many people know about this. Okay, so I'll show everyone the graphics that shows what fistula is. Okay, so you can see that this is a picture of the anus. This is the anal canal. This is the anus. Okay, these are the skin of probably the leg. Okay, so my fistula, thankfully, is actually this what they call superficial fistula or the low fistula, which is the easiest to treat or operate. Okay. So some people may ask, so why or how is this canal being formed? Okay, so for the anal fistulas to form, one of the reason could be that the anal glands located between two muscles of the anus are being blocked or inflamed, and that's when abscess, or we call it pus, develops at the affected anal glands. And due to the progressing infection, the swelling increases and the abscess may press against the skin around the anus. Then it may empty spontaneously, and then after that the abscess will heal again. But because there's an open connection between the anal canal and the skin, even if the external skin heals, it may come back again. Okay, so I will show you what actually happened to me. As you can see in the picture, this is the anal gland blockage, the part which causes the abscess or the pus to form. Okay, so this is the internal anal canal, and so because of this blocked anal gland, it actually secretes abscess, and the abscess is being accumulated here. And once the abscess accumulates to a certain level, and this part of the external skin will start to be swollen, inflamed, and there'll be pain, and the pus will start to flow out. Okay, so when it empties, this inflamed part will start to heal, and basically will heal until probably until a small tunnel here. But this tunnel will not be able to heal completely because the blocked anal gland is constantly secreting the pus to this area, and that's why the whole process will repeat again, and that was what happened to me. Okay, so what are the possible causes of the blocked anal glands, some may ask. Some of the causes are insufficient fiber, obesity, could be due to allergies, could be due to bacteria or yeast infections, and yeah, sometimes soft stools or diarrhea, frequent soft stools or diarrhea can prevent the glands from being expressed naturally, and that's when the anal glands get blocked. Okay, so stress is another possible reason. Can also be genetics. Okay, so there are a lot of reasons for blocked anal glands, and so just to let y'all know, these are the possible reasons. Okay, so as I mentioned before, if you have anal fistula due to this blocked anal glands, you will have on and off inflammation near the external area of the anus, the skin of the anus, and it will become swollen, and then the abscess or the pus will start to flow out, and after a while it will heal, and then after maybe 1-2 days it will come back again, and the whole cycle repeats itself, and there'll be pain, there'll be irritation. Okay, and in more serious cases, some patients may have fever and fatigue as well. Okay, so I will now explain what actually happened during the operation that I went through 1.5 weeks ago. Actually, almost 2 weeks. Okay, so I went for a surgery to operate on that fistula, and I'm fortunate that this was a superficial or low fistula, and the surgery was fairly simple. Okay, so during the surgery, a metal probe is used to locate the tract between the internal and external opening. And depending on the amount of muscle involved, the surgeon will decide whether to cut or excise the fistular traject on the guidance of the stylet, which is quite technical, so I won't go into that detail. So basically, I'll show you the picture of what actually happened during the surgery. Okay, so this is the picture. As you can see, this is the metal probe which I mentioned, it looked like a stick, kebab meat on a stick. Okay, and so this is the probe that will be able to find out where the track is, and after that, the surgeon will make a cut on the skin, and then after that, what happens here is that the surgeon will cut open this part of the muscle and the skin, and he will clean up this area, and after that he will stitch the upper part of the fistula and allow the open wound to heal by itself, so that it will be able to heal more completely and less infection will occur. Okay, so basically this was what happened during my day surgery to treat my fistula wound. Okay, so there you have it. A complete explanation of what happened to me and what I went through during this month or 1 month or 2 months, and now everyone knows about fistula. And if you have friends or family members who are experiencing the same symptoms as I am or I had previously, do consult a doctor on this. And sometimes a doctor, a normal general practitioner may not be able to diagnose this immediately. So if required, it's good to go to a colorectal specialist to fully diagnose the issue. And I hope everyone has gained some knowledge from this video, and hopefully no one will have to go through that experience that I went through. I'm on the road to recovery. I'm getting better and better by the day, and soon I'll be able to jog and go to the parks and forests and to take more videos to show all of you. So if I will be putting the link where I found this information in my YouTube video description, so you can go and check it out yourself if you're interested to know more. So have a great week ahead. The weekend is coming. Have fun, enjoy yourself. I'm gonna recover soon, and I'm gonna be jumping, dancing, running about, and I'm looking forward to that day. So that's all for me for today, and have a beautiful day ahead, people. And I'll see you again on Make Health Wealth Your Passion channel next time. See you around. Bye.